We call healthcare workers superheroes all the time, and knowing what they do every day, it's absolutely true, but they're not immune to having these issues with mental and emotional health. And so it was really about finding a way that they could have an outlet and access to great resources to help with those types of issues that came up.
If we want to care for our patients and families in a meaningful way and make a difference in their lives, we've got to care for our team members first. Our people have to be well if they're going to make that difference for our patients and their families.
So I think with the onset of COVID, we were seeing a decline in usage of our mental health solution. That's not something you would expect to see when you're in the height of a pandemic and we're surging and there was no vaccine yet, so many uncertainties. And so that's really kind of where we started and looked back and saw we need something different. This isn't working.
With our old historic traditional EAP model, we literally were at about a 2% utilization rate. And so luckily when we started looking at other solutions and saw something like Spring Health, we saw that there was opportunity to have engagement.
Everything from the connection time to team members, the time to appointment, the AI technology kind of behind the scenes with the assessment.
The companies we were talking to were primarily coming in and saying, hey, this is our product, this is how it works. And then when we met with Spring, they were like, well, this is our product, but what can we do to make it work for you? How do we customize it? How do we make it a solution that works for your team members?
The most significant thing that Spring Health brings to the table is their on-site care navigators. So we've been able to partner with them and truly weave them into our everyday fabric here at the facility level. They are a part of our organization. They're more than a partner, they're a team member.
If you do need to talk, I'm here. And it's 100% confidential because all of them are not necessarily ready to make that step in seeing a therapist, but they just need to talk in that moment. So definitely being able to provide that for them, and then they get comfortable. They have someone familiar that they can call on when they're ready to take that next step to choosing a provider.
And so knowing that they've got kind of this one resource to go to no matter what, like we're always gonna be there. Like that's the culture that we've created. You always have someone there.
Wellstar is great. I wouldn't be here for 20 years if I didn't love doing my job and they didn't take care of me and make sure I was supported.
Knowing I've been here for 15 years, that's a long time, and they've always had my back. I've always got their back.
There's so many resources that Wellstar offers to help those people that need the additional assistance. Spring Health is one of them. There's wellness coaches that they can go to. There's lunch and learns. There's a wellness room that they have resources to step away should they need those additional resources. People talk about it more. It's more out in the open. They've really provided many, many different avenues for us to seek the help we need or just feel comfortable in talking about our mental health and where we are.
Our evolution is now more of the mindset of how can we better take care of our community that takes care of our community.
I don't take care of patients. I'm not a frontline team member, but I have to take care of those frontline team members. That piece is hugely important to me. Are we providing things they need? Are we providing the resources that help their life? Because they have a hard job. And if I can do one thing to help their world be a little bit better from an emotional and mental standpoint, then I feel good when I go home at the end of the day.